around a little bit. We
Sorry.
it's all right. We moved around a little bit, but then I ended up junior high and high school in a town called Charlottesville, which is home to the university. I met my husband in grad school in Arizona, and he's from South Arkansas, and that's how I got to Arkansas. So 23 years later, here I am. I've been here for 23 years. I've worked in Fayetteville for 17 as a physician assistant. I'm a mother of one. We have 2 dogs, and we pretty much love sports. That rules our life. One of the questions was what brought me to my current job. So when I was in high school, I actually thought I wanted to go into either law or the FBI. I tore my ACL playing volleyball, and my surgeon who repaired my ACL was actually a team doctor for the University of Virginia. And so I got to do my rehab in their athletic training room. And that a goal of mine was always to be able to play somewhere in the collegiate level, but I wasn't talented enough. But that was an opportunity for me to still stay with sports and help people get back to their goals by rehabbing them. So I ended up actually getting a degree in athletic training at Appalachian State. And then I went to Arizona State to get a master's in education. While I was there, I was actually the athletic trainer, the graduate assistant athletic trainer for the volleyball team. So got to travel with them and take care of them during my time there. I married a coach, and who again was from Arkansas, and we moved to the Pine Bluff, Whitehall area. I worked at UCA for a year as an athletic trainer, but that was a very hard life. Athletic trainers have long hours. You're there before practice, after practice, even on off days, you're there taking care of the athletes. And coaches have long hours, so it just wasn't very conducive to our marriage to have those 2 sports or 2 fields together. So I started looking for something different where I could still use the healthcare experience that I had. And ended up going to physician assistant school. I went to a school in McKenzie, Tennessee called Bethel College. And I graduated in 2005. Since I've been out of school in 2005, I've had several different positions as a physician assistant. My first position, I worked more in a family practice where I did a walk-in clinic in the mornings, but my connections as an athletic trainer allowed me to have a position working with the University of Arkansas athletes in the afternoons. After that, I did that for several years, and then I ended up going into orthopedics, where I assisted with joint replacement, hip and knee joint replacements. And then I'm currently working in neurosurgery. I've been here for 11 years. So just to give you a little bit of background about this profession, there are some accolades from the U.S. World News or U.S. News and World Report 2022. Physician assistant was listed as the number 3 out of best 100 jobs list. It was number 2 on best healthcare jobs list, and it was number 3 in best STEM jobs list. So quite a popular route in the country today. So what is a physician assistant? The actual definition is that we are licensed clinicians who practice medicine in every specialty and setting. It's important to know that we are transitioning from the term physician assistant to physician associate. There's been some confusion when people hear physician assistant, they think we're still in school learning to be a physician, but we are our own healthcare practice. The PA profession actually started in 1965. Duke was the first program. And basically what they did was they took Navy corpsmen and medics who had training during their experience in the service, and they put them on a fast track, similar to how they trained doctors on a fast track in World War II. So that's kind of how we are trained along a fast track physician model. Today, there's about 159,000 PAs in the US. We work in all medical fields. Our goal is to expand access to healthcare. There's a shortage of physicians in the country for the amount of healthcare that is needed. Going to medical school is timely It's costly, and we don't have enough people wanting to do that or capable of doing that. So the goal of us is to expand that care. What do? We bring patients in, we evaluate them, we perform physical exams, we order testing such as X-ray, MRIs, CAT scans, we can order labs, we prescribe medications. We do minor procedures. These can be anywhere from drawing lab to splitting and casting. We can suture, we can remove skin lesions. We can also do joint and muscle injections. So there's quite a bit that we can do. And then we also assist in surgery. So while we're not trained to actually do the surgeries, we can be trained to assist in retracting tissues and putting in, different apparatus that is needed during surgery. There are some surgeons that even let their physician assistant do the final closure, where they do the final suturing. As physician assistants, we believe in being a team. We do not go and practice on our own. We heavily believe in a team model with our physicians. So we are not there to replace a physician, but work alongside a physician. Our role is to be able to handle some cases that may not require as much physician attendance, so that the physicians can actually concentrate on more complex cases. So currently, just for an example, is what I do here. I work in a neurosurgery clinic. Neurosurgery means we do surgery on the brain and spine. Currently in our clinic, we have 3 physician assistants. Our job here is usually we do the first visit with any patient that is referred to our office. So we bring them in, evaluate the patient. We interpret their scans. A lot of times we're looking at their MRIs or their CAT scans. We can order other treatments or testing if needed. And then we try to do conservative treatment before surgery. Not everyone has a surgical issue, and not everybody wants surgery, and surgery is usually a last resort if we can help it. So as a patient comes in, we evaluate them. If there's something that we think that we can treat conservatively, we will refer them to pain management or physical therapy. If it looks like it's something that needs surgery, then we get them in with the surgeon's schedule. Here in our clinic, the surgeons, most of their schedule is filled with people that actually need surgery. They're only here twice a week for clinic. The rest of the time they're operating. So we really have an important role as far as getting patients where they need to be, either with the surgeon or out getting other care that they need. Or the physician assistants, including me, we also do post-operative evaluation. So after someone has had surgery, they'll come in and see us. We'll look at their x-rays, make sure they're doing okay, and we follow them through their post-operative route. I follow fractures from the emergency room, people that have broken their spine. I also follow head trauma. So people that have had concussions or head bleeds or prior head surgery, we follow that too. A normal day for me here in this clinic, I usually am here an hour or 2 before I start seeing patients. That gives me an opportunity to go through any imaging that I've reviewed. So if I've ordered an MRI on someone, I can go and look at that and then get those results back to the patient, discuss with them a plan based on those images that we got. I also go through patient calls, questions, medicine refills, those kind of things. Here we do go through the imaging with our patients. So each office visit takes about 30 minutes. So we see anywhere from 10 to 13 patients a day. And then at the end of the day, I'm finishing notes and again, going through patient calls. Also, a few times a week when my surgeons are in the office, I visit with them. So when there are complex cases, that's where the teamwork comes into play, where if there's complex cases or patients that aren't doing well, I sit down and talk with their surgeon about them and we come up with a plan from there. What's required to do this job? The physician assistant position is actually a master's degree level. And it does require healthcare experience before going into that master's degree. Again, it's a fast track program, so there needs to be some kind of a basis as far as knowledge before being able to do that. I did some research for this, and it looks like most people applying to PA schools now are getting at least 3 years of experience in some kind of healthcare position. So you have to have a bachelor's degree first, which is a four-year degree, usually in some kind of science or medical related field. There are programs now that offer pre-PA bachelor's degrees to get you ready for the PA program. But during those bachelor's degrees, a lot of students are working in the summers. They can be a medical assistant, EMTs, paramedics, lab assistants, ER techs, surgical techs. So some kind of experience and exposure to the healthcare field is very important and required. As far as undergraduate requirements, I looked up some of the courses that are required: anatomy, physiology, biochemistry, chemistry, biology, organic chemistry, English comp, genetics, medical terminology, psychology, and statistics. Those were the main ones that people would need to get in their undergraduate degree. So the basic steps to become a physician assistant is obtaining your bachelor's degree and getting your healthcare experience, then applying to a PA program. Those are usually anywhere from 2 to 3 years. The first part of a PA program is usually mostly classroom, where it's intense learning. I think we did the whole cardiac system in 3 weeks in my program, that's a huge system. So pretty intense, but it's 2 to 3 years. The first half of it is usually classroom. The second half is your clinical rotation. So anywhere from 4 to 6 weeks with different fields of medicine. You follow either a physician or a PA usually for those. After graduation, there is a national certifying exam that must be passed. And then after that, you look at what's required to practice in each state. Usually there's a licensure program or policy in each state that you have to complete. Long-term, we are required to get 100 hours of continuing education every 2 years. In addition to that, we have to retake our boards every 10 years. So quite demanding, and it keeps us up to date as far as the new strides in medicine. As far as demands, I think you have to have a strong work ethic. You have to be able to a self-starter and really have a strong work ethic. There's no clocking in and clocking out. You have to just handle what's happening to you. Here I get sometimes on Friday afternoons, we have someone show up right at closing time that maybe have a wound and infection or some issue with their wound that we have to handle. You can't just say, oh, I've got a date, I got to go. So definitely strong work ethic. You have to be able to handle the situation. Strong ethics, that's always important in medicine. You're taking care of people. It's an honor to take care of people. They're at their most vulnerable. And so you have to always think about what's best for the patient, not what is the easiest or most convenient. You need mental toughness, decisiveness, reasoning skills to be able to look at a situation, look at different options, and then find the best solution for your patient. And my current position isn't physically demanding. I'm sitting a lot of the time. I am testing strength in the upper and lower extremities here. It's not physically demanding, but it's mentally demanding. Everyone hurts. Everyone needs you to help them. And it's just, you're trying to make the best decisions for people. And then there are, in neurosurgery, we have a lot of emergency situations too, between, we deal with brain cancer, head bleeds, fractures. We have people that are paralyzed or at risk of being paralyzed. So that's, it can be mentally challenging here too. There are other positions that are more physically challenging. There are surgeries such as doing scoliosis surgeries, which are really long spine surgeries that can take 10 to 12 hours of standing. So there are, other positions there. Similar jobs, we're probably most like nurse practitioners. A lot of people in the state of Arkansas are more familiar with nurse practitioners than they are with physician assistants. We pretty much do the same thing. Our route is a little different. Again, we're fast track medical or physician trained. They are more trained through the nursing route. They have to be a registered nurse first, then get some more clinical experience, and then they go back to nurse practitioner school. But at the end of the day, we do a lot of similar things. There's nurse anesthetists. I can't say that word very well, but they work under anesthesiologists. So they're an extender of the anesthesiologists, and we actually have several at our hospital that help our surgeons to provide that for our patients. And then, of course, we work with registered nurses and physicians as well. Let's get to the good stuff. Everybody wants to know what the pay is, right? Nationally, and this has come up since I started, but nationally they are saying starting pay is 90 to 100,000. Now that's nationally. I don't think Arkansas is there. So you have to take into account, you know, your location. Bigger areas with a bigger cost of living, obviously the pay will be higher than what we might be in Arkansas. It depends on your specialty as well. So a lot of times your specialty providers, meaning orthopedics, neurosurgery, dermatology, all those kind of specialists, those areas tend to pay more than family practice or pediatrics. It also depends on what you're doing. So there is a lot of places will pay extra for you taking call for the clinic or for your surgeon. So, and then there's opportunities with a lot of places to make bonus based on what revenue and how many patients you see and those kind of things. So that's how you can change your economic profile there. The nice thing about this field, when I switched from athletic training, I was really looking for what can I do with my education outside of athletic training, and I was very limited. I didn't have a business degree. I don't know anything about insurance or anything business. The nice thing about physician assistant is I can change fields, as I told you where I've worked before. If I want to go work tomorrow in ear, nose, and throat, I can do that as long as a physician is willing to train me. So our training is basic. It's family practice. So we get trained on everything from a basic level, but we can go into different fields just as long as our supervising physician is willing to train us. And so that's really nice because you're not stuck in a position. And what I have found is it's not only what area I practice in, but who I practice with that is important. My family here is my work family. I see them more than my real family. And so it's really important that if I were in a bad work situation where I didn't enjoy it, I have the option to go somewhere else. So it doesn't lock you in. And that's one thing that I love about it. I work for Washington Regional Medical Center. We are locally owned, a nonprofit hospital. The name of our clinic where we work is the J.B. Hunt Transport Services Brain and Spine Clinic. That's a mouthful. Washington Regional has several centers of excellence that we have achieved, and that's just based on patient outcomes and things that we have done to nationally be accredited for a higher level of excellence for our care. And that's in our heart services, neurosciences, senior care, total joint replacement, as well as women and infant services. That's a little bit about Washington Regional. As far as PA programs, the two that are in the state currently are at Harding Academy in Searcy, and then also at UAMS in Little Rock. There is an osteopathic school in Fort Smith that I hear is going to be starting one, but when I looked, I didn't see that it was active currently. So those are the two programs currently. And then there's some other resources if you're interested. There's the American Academy of Physician Associates. Again, we're transitioning to that associate term, and that is aapa.org. And then there's the Accreditation Review Commission on Education for the PA, and that's arc-pa.org. So that's kind of my spiel about the PA program and what I do, and I've really enjoyed it. I love being able to practice. I see patients. I'm a people person. Get to see if I can help them. If it's not me, I can shuffle them down to either if they need surgery or another provider. It's really gratifying. It's nice for me to be able to feel like I'm not locked into a position long term too. So that's all I have. Happy to answer any questions.
All right, so let's open up the chat. And if anyone out there has any questions for us, and for Miss Harper, let's get those in the chat and I will relay that. So were there any classes that you took in high school? First off, did you know that this is what you wanted to do?
I didn't know until my junior year.
Okay.
My brother had torn his ACL his senior year wrestling, and then I did mine my junior year in volleyball. And then that's when I did my rehab, and I was like, okay, I'm not going to be able to play somewhere, and this is probably what I want to do. So, you know, when I was in high school eons ago, we just had the basic curriculum. We didn't really have any option to really branch out and do anything. My healthcare experience came with my athletic training. With that background, we had to, you know, we worked 20 to 30 hours a week in the athletic training room in undergrad. And then my graduate program, you know, I was the trainer for the volleyball team. So all that counted as my healthcare experience.
So you need to be a student now because a lot of our high schools have a lot of medical field.
There was none of that in my high school. It's all basic.
Okay, so we've got a question. How do you deal with the emotional and mental strain of the job?
That's a good question. You know, the nice thing is that we do limit our day. You know, we don't see patients from 8 to 6 or 8 to 5. So it is nice that my last patient is usually booked anywhere between 2:30 or 3. So there's some time at the end of the day where I can just, you know, kind of decompress. I exercise. That's part of it. I enjoy cooking, so I go home and do fun things. I'm a podcast listener. I told you in high school I wanted to be in the FBI, so I listen to all this true crime stuff. Weird, I know, but that's pretty much. And then it's really nice. We have 4 surgeons in our office, and each surgeon has a nurse. And then we have medical assistants too. So, and then we've got 3 of us PAs. So it's kind of nice that we get to talk about it and let off steam between each other because we're all in this together. So it's not just, you know, weighing on me. So, and we've got people that have been in neurosurgery for 18 years. I've been here for 11. So it's nice just to have other people that get it. Because when I go home and talk to my husband, he doesn't get it. So. Which I don't get a lot of his education stuff either. So it's just nice to have people that are in it with you, you know?
Yes, definitely. Okay, any other questions out there? Maybe we've got one coming in. So if somebody was going into this career, I know you said earlier, chemistry, science, just anything science related.
Yeah.
Okay.
You'll have to have that in order to get into a program anyway. A lot of those degrees, you have to like it. I mean, that's what our body is. It works on science. But the more of those things that you have, the better, you know, even in undergrad, because it's a foundation to lay on for sure.
Okay. All right. So one school said they may have missed it, but where did you go to PA school?
So I went to a little school in McKenzie, Tennessee called Bethel College. My situation was a little unique because I was actually out of grad school and married and working as a trainer for 7 years before I went back. And when I decided, I said, okay, I'm going to give it this one to go. And if I get in, great. If not, I got to find something else. So Bethel College was the last program accepting applications. And I didn't get in at first. They saw where I hadn't had microbiology and I was actually taking that they didn't realize it. And I was so far removed from my GRE because I had been out of grad school for 7 years that they questioned that. And so I actually wanted it. And so I called and talked to the program director and I said, hey, I know that what can I do? I just want you to know that I have a master's already and that I'm taking this class. And she said, you know, we were just re-reviewing your application just now. I mean, it was it was a miracle. And so yeah, that's how I did. But today, there are the traditional PA school student when I was going through, we had been out working a while. We had EMTs, we had lab techs. We had a girl from China that was a cardiologist already in China that didn't want to go back, that went. So a lot of these people already had been working in the field for a while, but today's students are doing the pre-PA program and going straight in and getting a lot of their medical experience in the summers and getting started a lot earlier and getting started in the career a lot earlier than I was.
All right. Well, we've got someone's sister who went to Bethel and she's a
Oh,
PA
wow.
in Conway.
That's
Yeah.
awesome. Yeah.
Okay, so we've got another question. Was the schooling tough, or what was the hardest part of going to PA school?
The schooling was really tough. And it was a blessing to be in McKenzie, Tennessee, where there was nothing to do but study. Because I lived there full time. My husband stayed in Fort Smith. That's where we were at the time. I had a little apartment, and when we weren't in class, I was studying, and we would meet up at the Dairy Queen for a study break. It was very, very tough. And again, when you talk about, you're in class basically from 8 to 4 every day. Fridays got cut a little short in case we wanted to go home. So it was like a half day on Fridays. And in between that, we did clinicals a little bit, just observing during the week. But you're learning anatomy, physiology, how to do physical exam on that body part, and then all the diseases that go along with that system. So I know I pulled out the cardiovascular. You're talking congenital problems where people are born with bad hearts, bad valves. You're going from basically birth to death, things that can go wrong with the heart, in addition to learning about the anatomy, physiology, how to recognize all this, what to do about it, medications, pharmacology, all at the same time. So it's a lot of material. I think that was the hardest part. The clinical rotations were fun. We had to do clinicals with primary care, internal medicine, general surgery, orthopedics. Orthopedic was a elective. I did some vascular surgery. So it was that's fun because you actually get to apply it. It's different when you are seeing it and go, okay, these are the labs and this is what goes with it, and apply it. But the hard part was the book work for sure. And then the exam that you have to know it all. Yeah, the exam is hard. And I've had to retake it now twice recertified twice now. It used to be every 6 years, and now they've spread it out to every 10. So I've passed it 3 times now.
So does the test get harder, or do you find it easier because you've been in the trenches?
Well, it's harder for me because I only do neurosurgery now. I haven't listened to a heart on a real patient in a while, and so I'm not dealing with all these medicines and pulmonary issues and, gynecological issues and pediatrics. And so when you specialize, yeah, it's harder because the exam is family practice based.
Okay. So you talked about your rotations. What was your favorite rotation that you did?
Honestly, when I went through school, because I had been an athletic trainer, I assumed I would go into orthopedics, which is joint and muscle and bone stuff. And so I really enjoyed that. I had actually decided to go to work for a company in Fort Smith, and they wanted me to get some more internal medicine experience. So I did 2 clinical rotations with internal medicine just because they wanted me to round on their patients. So just because you do a knee replacement on somebody doesn't mean that they won't have high blood pressure when they're in the hospital, and you have to address things like that. So they wanted me to get that experience where we could address that. But orthopedics was just, natural to me because I'd been an athletic trainer and dealing with it for so long. But that was fun. And then actually I had a country doctor in Ozark that I did a rotation with. And he would just let me go in there. I would go in, get the history, do the physical exam, come out and tell him. And he just let me have the reins basically, and I would come back. And that's a lot better than being micromanaged, where some preceptors don't really let you go in and do a whole lot with the patient. You're just kind of following them, and you really learn a lot by getting your hands on people. And then the ER was fun too, because my preceptor said anything that comes in that needs to be sutured, you're the person. So I got a lot of suturing experience in the ER.
Okay, do we have any other questions? Now, you said that you didn't get into school first. It's a good thing that you kind of took the initiative to call them and kind of let them know that it's something that you really wanted. Yes, they were looking at your application, but you had to have that stick-to-itiveness, I guess.
Well, I was kind of desperate because I didn't know what else I was going to do.
Yeah.
And at the time, so different programs will take applications at certain times of the year. And there is one of those websites, I think, is where you can go on, and they'll have all the PA programs and when the application deadline is due and what's required for them. And so at the time, and again, I was a little bit older, and we had been married for 7 years, and it was like, hey, we got to figure something out, and so at the time, that was the only one that was still open, or else I'd have to wait a whole nother year. So, but yeah, I think it was, I just wanted to at least let them know, hey, because I don't think that they knew that I was taking microbiology, which was required. And then I just clarified, do I really have to take the GRE again when I already have a master's degree? So, and they were like, we were just looking at it. And there was another athletic trainer in my class too. But yeah, absolutely. I even, so I precept a lot of students wanting to get in PA school here now. And if they haven't gotten in, I always tell them, hey, call the admissions and talk to them and say, hey, I understand I didn't get in. What am I missing? What can I do to give myself a better chance next year? Because it's amazing what some of these students are doing. They're working as lab techs and stuff. I know Harding in particular, and maybe UAMS, they're very conscientious of giving back. And so some of these people have been on mission trips, medical mission trips. I mean, it's amazing what these people are doing to get into PA school, and that's your competition. And so if you don't get in, that's okay. It's an opportunity to learn and see what you can do better.
Okay. All right. All right. So the main difference between a PA and an NP, is it that the NP is more clinical based, or what?
And this is being recorded. Please research the nurse practitioner field, please, because I'm not well versed in that. What they always say is we're trained to think like doctors, PAs are. We're trained by physicians to make these decisions based on how a physician would. Nurse practitioners are trained through the nursing model, so a lot more education based. Is my understanding, again, please research this, that nurse practitioners have a couple different pathways. One is family practice nurse practitioner, and then the other one would be more critical care. So family practice can only work in family practice. Critical care can work in the hospital. They can do first assist. They can see patients in ICU, but there is that limitation of the family practice for them. But we pretty much do the same thing. We actually have just hired in the last few months another PA and a nurse practitioner that are both hospital based for us. We just have so much hospital work that we needed some extra work in helping with rounding. So both of them help our physicians. They round in the mornings. They also seek consults for our physicians in the hospital when they're consulted. And then they also both will help with surgery as well, first assist. So really and truly, I don't like to drive a line between PA and nurse practitioner. The route to get to them are different. It's my understanding as a nurse practitioner, they have to get their RN first, then have their clinical experience, and then go back to their nurse practitioner degree. That's master's. They're actually pushing doctorate now. So the way to get there is different. There is some limitation on the nurse practitioner, especially if you do family practice. You can't see ICU or help in surgery, but otherwise we pretty much function the same.
Okay. All right. So if somebody wants to know what all specialties you have worked in.
So family practice, and my role in family practice was a walk-in clinic. So, you know, when you get sick on Friday and you just have a sore throat and your doctor doesn't have an appointment, you can come through the walk-in clinic, or, you know, need to get a shot or sutures, those kind of things. So I did that half my day. And then the second part of the day, I did family practice for the University of Arkansas athletes. So we had 14 physicians that had their own clinics off campus, but they didn't have someone posted on campus to just handle when somebody was sick or had a UTI, or I helped do physicals for them, their pre-participation physicals, lab draws for some of the athletes that we worry about their iron, those kind of things. So that's what I did for 4 years. I split my time there working with them, which was fun. And then I worked in orthopedics, and the physician that I worked for mostly did joint replacement, hip and knee. We did some ACL repairs. We did some meniscus. We did, you know, of course, when you're on call, there's fractures and things that come through too. In that position, I was pretty much just right with him. So in my other positions, I was kind of on my own. If I had a question, I talked to my doctor, you know, came up with a plan, those kind of things, but I could see people on my own. With the orthopedic, I rounded with him in the mornings. We did surgery, rounded with him in the afternoons. We did clinic together. So it was kind of more, everything was still him based. I was just helping with the workload, basically. I didn't get to really make decisions on my own a whole lot with that. And then here, those are my three here at the neurosurgery clinic. And there are a lot of PAs that don't like my position, being in clinic all day. I don't want to listen to patients complain and all that. I love it. I love being with people and taking care of people. I'm not a huge fan of the operating room personally. I get a little weak. I know that sounds weird. I picked a good profession, but I get a little weak. I don't like standing there for very long. And then the other thing that I found, and I think there's that work-life balance. When I was younger, I worked my tail off. You know, as an athletic trainer, I wasn't thinking about being a wife or a mom, and I loved every minute of it. And the harder I worked, the better it was. We were all in it together. It was a team approach. But work-life balance is really important to me. And in the operating room, you don't have control. You don't know when your surgery is going to get started. You don't have control as to when you're going to get out. There are times when it can take 2 hours for them to turn over a room from one case to another, and it just drives, you're just sitting there waiting. You just don't have control. There were nights when I didn't know who was going to pick up my kid from daycare because I was stuck in surgery and I hadn't been able to talk to my husband. So that's what I don't like. I like this position because I have control of my schedule, but some people hate it. So there's lots of opportunities and lots of options.
Okay, so for those kids that want a family, you would say this would be a good profession. However, just
The
watch
field.
the specialty.
Yeah, the field choice. And it's not only specialty. I mean, one of the best positions as a PA is dermatology. You can do a lot of different procedures. You can take off moles, you can suture. They make good money. And there's never, ever a dermatological emergency. Nobody's going to die because they have that mole there overnight. So what that means is you don't have to deal with call and after hours and all that stuff. So
okay,
it's a great profession, but there's a lot of opportunity within the profession to do all kinds of things. There's actually PAs that work for the FBI. There's something called a body farm over in Knoxville, Tennessee, where they actually study decomposition of bodies. And so there's PAs that work in those fields. I mean, it's limitless.
okay. So when you said body farm, I went to another place. I was like, okay.
Yeah. And that's how they do their research and be able to solve crimes. They study those things and study all that.
Okay, well, I know that I've had some students that might want to go into this field, especially the FBI route, because
Yeah.
that seems to be a big interest these days.
Yeah. I was heavy into it. I told my mom and she said, "Oh, I'm sure there's lots of clerical positions in the FBI." I was like, "No, Mom, that's not really what I'm after."
No,
But I didn't think, I started reading some real books and stuff, and I didn't think that's what I wanted to deal with on a regular basis.
yeah,
So
I get that. I get that.
to each their own, for sure.
Yeah.
There's opportunity.
All right. Any other questions out there? We have about 15 minutes. If you've got other questions that Miss Candace Harper can answer. Is there anything else that you would like to add? I know we had some people jump on late. So if any of those schools have a question, let us know. While we're waiting, is there anything else that you might want to tell the kids out there?
I think that, I'm a prime example that it's really hard to decide what you want to do when you're young, for the rest of your life. I think that you need to consider, while you may not be interested in a family and all that now, I think you need to consider something called work-life balance. And that is just, we all work, we want to enjoy what we do, but we also work so that we can enjoy things outside of work. Whether that's family, whether that's, activities such as, I think about my son hunting, fishing, going to the lake on the weekend. So there's that balance there as far as what allows you to really, and you spend so much time at work, you want to enjoy it, but at the same time, you need to have a little break so that you can enjoy things outside of there. And so making those kind of decisions, not backing yourself into a corner, and planning, just really planning and working hard. And the first couple of years, usually in college, from my experiences, everything's about the same anyway. You're doing math, art appreciation, those kind of things. Sorry, I didn't mean to roll my eyes, but that was not my forte. Let's put it that way. But
any art teachers out there?
Sorry. No, I like participating in art. It's just art appreciation was not my thing, or music appreciation. But, really just making good grades now, it matters down the road. And then just, getting as much information about as many fields as possible. And then just trying to make good decisions on what your future life might look like, and when you might want to retire, and not having to work hard, and when you're 70, 80 in a labor job, that kind of thing. We see people that are trapped in those kind of positions all the time. So.
Okay. So I've got somebody that wants to know, like, if you're wanting a family, when would be the ideal time for a PA to start a family? During school? Or
it's always hard during school. I don't know how people do that. I couldn't have done it, because it is very intense as far as you're studying, and then you're in clinicals. So it just adds another level of stress. I always recommend being out of school before you start family. But it's done. We had people in our class that had families. We had a guy that actually was vice president at a hospital that came back to PA school, and his family was older. But having young kids going through PA school, it just adds another level of stress. That doesn't mean it can't be done. People beat those odds every day. I would have struggled. I would have struggled.
Okay. All right. What about internships? Do y'all offer internships there?
No, not now, but that may be something that we entertain down the road. I do have people that are interested in PA that are in undergrad right now that do come and shadow me. And then I do precept students with UAMS and Harding from time to time.
Okay. So do you have shadowing opportunities for high school kids?
I bet we can make that happen. I'd have to talk to our HR department. That's really through Washington Regional, but I bet if somebody wanted to come for a day, we could probably make that happen.
Okay.
I think that would be wise.
Mm-hmm. Okay. All right. So keep that in mind out there, guys. All right. So one school missed the beginning, and they are wondering why you left athletic training.
So athletic training has a lot of hours associated with it. My dream was to be an athletic trainer on the collegiate level. And so to do that, you usually have to have a master's. And so I did work at UCA for a year. And then we were living apart. We were each driving almost an hour opposite directions when I was married. And so that was a hard position when you're working 7 days a week. But long story short, I left because the pay was not good and the hours were too long. The most I got paid as an athletic trainer was 30.
Oh, yeah.
I don't know what the pay is now, and it depends, I would think, on if you're in a college versus a clinic setting versus, employed by a school and teaching too. But it's not great. It's good. It depends on what your lifestyle is, but it didn't allow me enough time to enjoy my life. And then the pay wasn't what I wanted.
Okay. All right. So I've got another school that wants to know what specific procedures could you perform as a PA in dermatology?
So I've never worked in dermatology, but obviously the big trends now are all the fillers and Botox, those kind of things, injectables. They do a lot of mole removal, skin lesion removals, burning or removing those. Those are most of their procedures. I've got some lesions on me that my friend in dermatology is attacked. They see a lot of, so our visits take a long time because we're going through imaging and MRIs and all that with the patient and showing it to them. Their visits are 10-15 minutes. They're in and out, and then they usually schedule a day for their longer procedures that they do. So the schedules of each profession can vary quite a bit.
Okay, we're nearing the end here. So any other questions for Ms. Harper here before we close out? Teachers, do we have any people in your rooms that want to be a PA? I see one classroom there. Guys, can y'all raise your hand? Do you want to be a PA? Any of y'all? Miss Creamer, your classroom? Oh, maybe.
I scared them.
Okay, all right. Well, Miss Schaefer's group, they have a couple. Keys have 2. So you've got a couple out there. Hey guys, if y'all, want to do the shadowing, you can contact me, aramsey@gentrypioneers.com, and I'll get you Miss Harper's contact information. So we can see if we can make that happen.
Yeah. And if it's not with me, if we have limitations here with me, the nice thing about the PA community is that we all try to help. And so I do know we network. And so we can make it happen somewhere else, but I'm happy to try. We just haven't really had a high school student yet, but I think that that's something that I'm not opposed to. So we'll try to make that happen.
Okay. All right. All right. Well, thank you so much for joining us today. We really appreciate it. We appreciate you giving us your time.
Well, thank you all. Thanks for joining this talk. I appreciate it.
All right. Well, have a good rest of the day.
You too.
Thank
Bye-bye.
you. Bye.